I'm so excited to take over today talking to you about being a dysphagia clinician, my passion, Dysphagia Cafe, and all things dysphagia-y. Dysphagia. Sure you send all your questions in. I'll be here all day, or kind of all day, maybe like for like an hour or so. I don't know, maybe 20 minutes. But no, I will be here all day, so just send your questions. Housekeeping, I want to make sure that there's no corporate entity that controls what I say. So, there's lots of financial disclosures. I'm my own person. Swallowing is kind of like an Audi. It goes from 0 to 60 and just like that. Before I get started, I want to make sure I freshen my breath with some fresh mint Tic Tacs. Only 2 calories per Tic Tac. So I've been working as an acute care therapist for about 9 years now in Southern California. I currently work at a level 1 trauma hospital in acute care and outpatient. Inpatient, I see trauma, cardiothoracic, neuro, head and neck cancer. Outpatient, probably about 90% head and neck cancer, at least in my population where I work. I will be the first to say I am not a jack-of-all-trades clinician. I love dysphagia and working with swallowing disorders. I love teaching it, and it's just my passion. A little bit about Dysphagia Cafe. I started it about 4 years ago when I was at a Dysphagia Research Society conference and really had an idea for education. I was literally at a cafe in Seattle and thought it'd be a great idea to start a website for accessible articles from world leaders in dysphagia research. So I encourage you, if there's a topic that you're interested in, just Google Dysphagia Cafe, plus aspiration, plus head and neck cancer, and you'll be able to find it. My first SLP job was in acute rehab at an acute care hospital. So I did that for 9 months and then really showed a desire to move up to acute, and I did. So this is actually my second career. I started in advertising, worked in advertising for about 4 years, and decided I wanted to change. I moved to LA with a communication degree in media. I worked in radio and media buying for a while. It was a lot of fun, but definitely needed a change. I really had no idea what I wanted to do. I went back to school, spent a semester in the English department, hated Shakespeare, but loved grammar. Somehow fate sent me over to the communicative disorders department, and my first semester was a lot of neuroanatomy, and I loved it. I had an opportunity to observe and shadow someone and really find out I wanted to be a medical SLP. For me, it wasn't a matter of being a per diem SLP in a medical center. It was pretty much that I wanted to be a medical SLP or else I wanted to do a different career. So I continued on and I got my master's degree at Cal State Long Beach, and I worked my first job at Long Beach Memorial Medical Center. So apparently being in media and a communication degree major didn't fit me, so I had to become a communicative disorders major to be happy. I have a very rare work schedule. I work Monday through Thursday. I do 10-hour shifts and I have Friday, Saturday, Sunday off. Very, very rare. I would say a typical schedule should be Monday through Friday, 8-hour shifts. There are weekend and holiday expectations in the medical center. Just depends. I would say to break into the medical SLP world is very, very challenging, but I think there are some options. It just depends on where you are. Number one, I would say try to find someone who's willing to teach you the best you can. Try to find a way to observe and attend as much educational courses as I know there are limitations and there are limited jobs in a medical center, but I wish I had some kind of secret advice, but I know it's difficult. Be willing to work per diem, be willing to learn, just be willing to grow your skills as much as possible. Lots of resources online. I would say definitely do not chase the money starting off. You want to find an experience where someone's going to be willing to teach you and mentor you. I personally wouldn't recommend being a traveler as a new clinician. You really want to be attached to someone who's willing to teach you and show you the ropes. I thought I'd talk about acute care for a little bit. Say that someone wants to work with adults in medical SLP, that really ranges a broad spectrum as far as what you're doing in the different settings. The majority of acute care expectations is about assessment and management of risk rather than actual therapy. So I could say that most of our evaluations are swallowing evaluations and then speaking valves for the trach patients. Very limited time on speech and language. In my hospital, very limited therapy again. It's more instrumental assessments in acute, assessment, again, management of PO, assessment of risk. If you're looking to gain skills in actual exercises and rehabilitative programs, again, probably acute care is not the place for you. Oftentimes when I see a patient first thing, I'm automatically thinking about discharge plan to a different level of care. I love acute care because I like the variety. I like to see different patients every day. I really love the medical challenges and learning about the medical chart and all the different etiology. The next area that someone could possibly work in is an acute rehab, where you will get a lot of therapy and you actually spend about an hour of therapy every day with the patient. This might be an area where you use different swallowing devices like an IOP, an EMST, where you're doing all the different exercises for like the tongue and the pharynx. A pro is that you can really hone your therapy skills. A con to this area is that you work with the same patient every day for 2 to 3 weeks, and that could get a little bit redundant. So after someone goes to an acute rehab or a skilled nursing facility, they may see you as an outpatient therapist. So that's another area. So outpatient again is assessment, but also a lot of instrumentation, objective studies, but also very therapy focused, probably more speech and language. In my outpatient setting, I do a lot of video stroboscopy for voice evaluations. I do a lot of FEEs, MBSs, and a lot of my patients are head and neck cancer patients. Someone wanted to know more about trach and vents and our role in trach and vent population, which is a very specialized area, probably one of my favorites, so I'll talk about that a little bit. I mean, you can spend hours at a continuing education conference learning about this, but trach and vents is really a specialized area that requires a lot of specialized skill and observation. Oftentimes it's facility specific as far as what our role is in a trach and vent population, but typically in my facility we look at patients who are stable off the vent. So we often get going with swallowing pretty soon when they're stable off the vent and can tolerate a trach cuff deflation. There's really so much detail to go into, a little bit too much for someone may manage a trach and vent patient a little differently in an acute care setting as opposed to a long-term acute care setting where they're spending a lot more time on the trach and vent. If you want to get into the medical setting, you have to be very comfortable with very difficult and challenging situations. These are very sick patients that we're dealing with. If secretions is something that grosses you out, or vomiting, or just the kind of smells and sights and sounds of a hospital setting may not be for you, but the only way to know is to check. As far as resources go, I mean, I made a point when I was in my clinical fellow and moving forward to always read an article a week to stay focused on reading resources online, or dysphagiagranrounds.com, which is a really good resource, swallowstudy.com, dysphagiacafe.com. There's a great book by Grower and Crary. It's one of my dysphagia books. It's a very small type of book, but very readable. It's very concise. I really like that. Critical Thinking in Dysphagia Management is a great course. They do have a website, I think thehopeisinthescience.com, but they have traveling courses, very good. So these next few snaps are just some words of wisdom. Again, it's just my opinion. I encourage you to seek out many other opinions from other people with different experiences. Dysphagia is a very complex area that we do not get a lot of training in our grad programs. You really have to seek out, read, and find your own. I would encourage you not to get caught in a trap of just being okay with the status quo. Continue to challenge yourself. Continue to find people who know more than you. Listen to others. Listen to doctors, what their opinion on is. Not everybody has their full focus on swallowing and swallowing disorders, so listen to what other people have to say. Physicians may have a perspective that's totally different from what we're focused on, but it's really important to take those pieces of nuggets and don't forget about it, because they were treating dysphagia way before us. Don't forget what we're treating here with swallowing disorders. Someone has lost the ability or efficiency to eat and drink safely, and so you have to keep that in mind. There's a human perspective. To manage dysphagia, we have to remember it's not just a neck-off process. The whole medical chart, the whole medical situation impacts what we're looking at. So those are my 2 cents over today. I know that most of you are probably have gone out by now and are partying or having a Friday. I'm sorry I wasn't able to get to every single question, but feel free to email me at dysphagiacafe@gmail.com or the contact us page on our website. Swallowing disorders is not anything fun. I'm doing an SLP takeover. Can you wait a frickin' minute?